Hi, everyone. I'm Amber Pearson. It's great to be here, and I'm a health geographer. So I'm interested in how where we live, work, play, and study affects our health generally. And one of those dimensions of where we spend time is nature, which all of us are interested in here. So I use tools like GPS tracking to understand how much time we spend in nature. I use viewshed analyses, how much visual exposure to nature we have. And we also use imagery, 360 camera imagery, Google Street View imagery to understand visual exposures, both positive and negative. And I also work with wildlife ecologists to deploy audio monitors and identify bird species to create soundscape maps across neighborhoods to understand exposure to biodiverse environments. And I moved to Michigan about 10 years ago, and I was really struck by, thank you, Michelle, for setting the stage. It's a post industrial state, lots of post industrial cities, the vacancy. And Detroit has been particularly affected by this. There's 25 square miles of vacant land in the city as a result of depopulation. And that also means lower tax revenue. So the parks system has suffered as well as a lot of other city services. So out of the 300 parks in the city, 50 have been designated as community open spaces. And what this means is lower levels of maintenance in these places. If you drove by them, honestly, they look like vacant lots. There's no signage, there's overgrown vegetation, there's dumping in these sites. So as part of the capital improvements plan for the 2017 plan for the city, what they decided was we'll let community stewards partner with the city and convert these spaces to one of three things. One of those things was grassland meadows, which is what Detroit would be if it wasn't a city. And so formerly Detroit Audubon, now Detroit Bird Alliance, partnered with the city, and they converted four of these community open spaces to grassland meadows. And I studied what happened to people who live nearby. And I designed a natural experiment to do this. So in theory, we've got this pre-intervention space, and then we've got this ecological restoration, removing turf grass, broken cement, all the dumping, and then planting a lot of flowering species, signage, intentional trails, and places to sit to show it's an intentional space. And then over the last and the idea is to benefit lots of things, pollinators, birds, and I'm most interested in humans. So I studied over the last 6 years what happened to people living nearby and in controlled neighborhoods that had an unmaintained park. And we are just analyzing the data now. We looked at physical activity, stress, and cardiometabolic health. The sample is comprised 90% of participants identify as Black or African American, 40% earn less than $10,000 a year, and really excited about our first results here. This is physical activity over time. The green is the restored park. The purple is the unmaintained park. And at year 4, we saw a 30-minute difference in an 8-hour day in total physical activity for people living near restored parks compared to unmaintained parks. So very excited to share that.